I'm Marty Olson, and welcome to City Focus. And tonight we're going to have a little different conversation. My guest is an old friend. Actually, we go back
grade school,
which is Harbor School. For those who may not know, I've got K. Robert Lewis with me this evening, and K. Robert is going to be chatting about what he does for a living, and he is the Department Service Officer for the American Legion Department of Connecticut. So we will be discussing what he does in that capacity, but I'd just like to give you a little overview of K. Robert, what he's done over the course of his adult life, I would guess we could say here. He was hired in his current position in 2011, and it's the nation's largest veteran service organization, the American Legion, and he's the chief advocate to assist veterans, survivors, and dependents receive earned benefits from the federal government. He's been honorably discharged from the United States Air Force in 1976. Previously, he worked as the Veterans Outreach Coordinator and Customer Service Training Administrator for the VA Connecticut Healthcare System, and for 6 years as Military and Veteran Service Representative for the Office of 2nd District Congressman Rob Simmons. A UConn grad with a bachelor's in political science, he's retired from General Dynamics in Groton after 26 years. K. Robert has held the office of Chairman of the National Veterans Affairs and Rehabilitation Commission for the American Legion from 2004 to 2009, and led site inspections at VA hospitals, clinics, and vet centers nationwide to ensure that America's veterans have access to world-class health care within driving distance and without horrific backlogs. A comprehensive annual report was presented to Congress, veterans advocates, and to the VA, identifying strengths and weaknesses, offering solutions, and lobbying for funding. Working with individual veterans and applying 20 years of experience and training by the National Veterans Legal Service Program in Washington, D.C., he has been an effective advocate, providing cost-free professional services to clients from World War II to Operation New Dawn. Last year, his 4-person office was responsible for nearly $20 million in disability, pension, and education benefits being delivered to Connecticut veterans. So you're providing quite a valuable service, it sounds to me like.
I think so. It's a calling. It's one of those jobs where we were always taught in school and through our life, do what you love. Well, from working with the Legion and working with the congressman, and now in this job, it's a wonderful opportunity to work with those who have served, for those who have sacrificed, and their families, and to massage, if that's the right word, the federal regulations to benefit the veteran and the beneficiaries, because a 84-year-old widow is not probably up to speed on the several thousand pages of rules and regulations governing whether or not she gets a pension after her war veteran husband dies. So our job is to, first off, and I think we highlighted that, American Legion service officers provide professional service at no charge. Our salaries are paid because our members pay their dues.
When you say members, American Legion members.
American Legion members and service officers and the other veteran service organizations function in the same way. Now, I'm a state service officer. I am supported at the local level by local post service officers, who often are the person that the local veteran or local widow knows and turns to. They can start a contact, interview people, forward the information to us. We'll follow up with a follow-up interview, whether it's in our office in Newington, West Haven. We're currently doing outreach at various vet centers, community colleges, and we do make house calls.
Really?
So going to where the need, a case in point, and I don't believe he or his family would mind me speaking about him if I don't mention his name. A gentleman from Stonington was stricken with ALS. It's a terminal disease. It's debilitating, and if a person served for 90 days on active duty, 90 consecutive days, which is something we're actually fighting, because if there's no specific cause, but it's related to active duty, then why should 90 days?
Active duty does not translate into going overseas or
Correct.
into a hostile environment.
Correct. Stricken with Lou Gehrig's disease, ALS, affects veterans at 3 times the national rate. So it is a presumptive disease, and one of our a Coast Guardsmen from Stonington was stricken. His family contacted us. We went down to the house, set up his claim. We walked it through, and made sure as much as we could that the family didn't have any hassles, that they didn't have to keep running back and forth to the hospital visit.
Bureaucracy.
That's our job, and part of that is developing a relationship with the bureaucrats at the regional office in Newington, and a bureaucrat isn't necessarily a bad name; it's a position, and the director has a open door. We have worked on a number of issues with them. We've worked on some outreach with them. We are currently, what I think is exciting is the VA, and it's been in the press. They're trying to come into this century. A lot of our claims that people file that I work on now, there's no paper there. Everything's been scanned in, and all the input is online, so I can view it at a satellite office. We can update it, we can check it. And veterans also, if they go to e-benefits, a site hosted by the VA, and get their personal password, they can go ahead and they can enter a claim online without ever going to the office. That's a plus and a minus, because it means that there's no paperwork to sit on somebody's desk. However, we always encourage people, there's a little addition in the program. Before you click submit, there's a little drop-down menu that tells you what veteran service organizations do, and it offers the veteran the opportunity to click on one.
Okay.
And we will review the claim for them.
Yeah. In that vein,
Yes.
can you briefly kind of give an overview, or what's the mission of the American Legion, as opposed to, let's say, the VFW? I mean, I assume that there are other agencies that, or clubs or organizations that interface with veterans.
Doing this in this vein, let me say that in the Newington Regional Office, there is a hallway with the Connecticut Department of Veterans Affairs, Disabled American Veterans, American Legion, VFW, and the Purple Heart Association. All those agencies do similar work. I think each of us likes to think that we're the best. I could say that we kind
of like the services themselves.
My staff, yes, we strive to have a very good outreach. We have a very good record of results. In the press, when they talk about claims backlog or appeals backlogs going down to Washington and lagging 2, 3, 4, 5, 6 years, the goal in my office is that we present a case with all the right information, so that when the claim goes up, whether it's the first shot at the regional office or a follow-up, that we get the veteran benefits then, instead of automatically having to appeal, which puts it on the docket and it looks good because it's going to be appealed, and some 78% of all claims that are appealed are sent back for additional work favorable to the veteran. So our goal is to try and make sure that all that work is done first, so that the veteran, many of who are Vietnam veterans, so that they get their benefits rather than wait for a retroactive check. And some of the retroactive checks, we've had to make a call to a widow and tell her to expect a deposit in her bank account of $436,000. She's just started laughing, which I guess is the appropriate thing. But it took many years, if you imagine how long she waited for that. So we try to help, especially our newer veterans. I'm going to call them 20-somethings because, now with the length of the wars, they're now 30-somethings. But we have a number of clients who filed claims in good faith, which they'll file for a disability, which is a injury, a illness, or a psychological issue. And the process is such that they can get frustrated. If somebody that is suffering from a PTSD and traumatic brain injury is dealing with the rigors of going to college after coming home from being overseas and trying to fight the VA for not only to get their injuries recognized and compensated, but to get it properly treated. So they're under stress and under medications. It makes,
Well, it sounds like it could be
makes it difficult.
mental and or physical.
Exactly, and we deal with all that, and our job is to be confidants, is to be counselors, is to be above all advocates. And we advocate not only, and as Legion members, we advocate, we battle the bureaucracy of the VA for our clients, but we're partners with the VA as well, because over the last 10 years, we've developed a conversation where we can have a talk and suggest changes. One of the issues that has always been there in the healthcare side, because this goes from claims, it goes to healthcare. The American veteran is fortunate in that we are the only veterans in the world that have our own VA healthcare system. Nobody else has it. It was put in place for us. And now in 2003, a good 40% of us were excluded from having access to it based on income. So we try to find ways to make the system work, especially with the coming of age of the new healthcare bill. Veterans who are enrolled in the VA healthcare system don't have to purchase the Medicare B and Medicare D. Now, can they? Yes. But if they're receiving something already and they're paying their co-pays, VA healthcare is a recognized healthcare provider. So that covers many veterans. I wish it covered more. They are our sister veterans are coming home, and their healthcare needs are starting to be met by the VA. I say starting because I think one of the toughest things is to get a 24-year-old female veteran to walk down the hall at West Haven VA Hospital when, other than the nurses, you're the only female of that age there. And everybody else appears to be between, quite frankly, 50 and 90. And they're all guys. And it's kind of hard to feel comfortable if they're,
how's this relevant to
if they're dealing with that mental health issue, trying to get to the women's clinic. So we have established a women's clinic. For veterans in our area, the New London Outpatient Clinic provides women's health care, mental health care, and that is down in Shaw's Cove 4, I believe. If you're a veteran, if any of your listeners are veterans and they haven't enrolled in VA healthcare and they've returned in the last 5 years from deployment, I encourage them to sign up for it. Even if it's not their primary healthcare, sign up for it, get your data in there, because the services that you don't use, the federal funding, there's a factor for outpatients of about $8,300 per person per year, if it's just outpatient care. Well, if a veteran only goes twice a year for his biannual physicals, they don't use all that, but it kind of rolls over into maybe those extra visits that 70-year-old ALS veteran is going to need, or conversely, a 40-year-old ALS veteran whose life expectancy went from endless to 5 years. Mm-hmm. So we work with all those folks.
Sounds good. Folks, I want to remind you that this is City Focus, and I'm Marty Olson, and I'm joined by K. Robert Lewis, who's the service officer for the American Legion here in Connecticut. We are live, and if you'd like to call, the numbers are on the screen at 860-440-3154, or if you're out of the calling area locally, you can contact us at 1-800-253-2285. So if you have any questions regarding services provided by K. Robert and the American Legion, this is a really good opportunity, whether you're a vet or whether somebody in your family is a vet. Survivors, dependents, the net is pretty large, it sounds to me.
Yes, it is. And I'd like to, specifically as it ties to the American Legion in this state. In 1919, at the birth of the American Legion, World War I veterans were coming home, and the veterans and the legislature sort of agreed that they to forego a mustering out bonus. Instead, they put the money basically into a widows and orphans fund, and the legislature, by statute, put the American Legion in control of that fund. It became known as the Soldiers, Sailors, Marines Fund, which is a nonprofit fund, if you will. It's a trust fund, which for about 20 years received a penny a pack off the cigarette tax. And that was from the 40s to 1961, at which time the trust was some $58 million.
Which at that time seemed like a lot of money.
Yes, at that time, it also, with some of the fiscal issues facing Governor Grasso at that time, it had been her thought to take that fund and put it into the general fund and tell veterans that the benefits would be paid, but they'd be paid out of the general fund, sort of like the lot of money for education. Now it's paid out of the general fund, if at all. So that was beaten back, and the Soldier Sailors Marines Fund is a sort of it's a emergency fund when we hope, and it's that provides food, clothing, shelter, utilities, covers medical bills, including dental for those in need. It is based on need. It is operated it's administered by volunteer service officers statewide. So when you're talking about the different VSOs, the VFW, DAV, and the Legion, our service officers all participate in assisting our local people on this fund, as it's a volunteer issue, which is why operating off the trust, the interest of the trust fund, so that the corpus isn't touched, we're able to help people to the tune of about between $2 and $3 million per year. Now that trust fund has been in the control of the Connecticut State Treasurer since day one. In the recent budget, as from the governor, without, to my knowledge, talking to anybody about it. I know he didn't invite us in from the Legion and the people that do the fund. In his budget, it just mentioned in the numbers that the state is going to divest itself from the operation of the fund as far as the 13 permanent staff members whose salaries are paid out of the fund. So all of a sudden the American Legion is preparing to and doing the groundwork, establishing a American Legion non-profit trust, a charitable trust, which, if the legislature approves the governor's effort, so the fund would move from the state treasurer to the American Legion treasurer, all with the same operational guidelines, which is that it remains a nonprofit trust, that only the interest of the trust fund is used. It can't be used for anything else. So it's rather exciting times, and this is, and again, the strength of the Soldier Sailors Fund and a number of beneficiaries in the New London, Niantic, Waterford area utilize the fund on a regular basis, and a real big shout out to a local post service officer fund rep who covers Niantic, Waterford, New London, parts of Montville and Groton, and he's a fellow Legionnaire. His name is Jack Lynch from Waterford. As a volunteer, he is retired, and this appears to be his full-time job. And this, so
now,
helping folks.
Do you get involved at all with jobs, housing, homelessness, or is that out of the sphere of what you're doing?
We absolutely do. Out of my office, we have a full-time person that works in the homeless areas as a liaison. Primarily now recall that we're in the Newington area, so we have a big liaison with all the veterans homeless shelters there, the West Haven area, directing people to transitional housing, assisting veterans in transitional housing to apply for benefits. That veteran that may be sleeping out in the woods or sleeping under the bridge may be harboring demons that have been there for many, many years. And sometimes they won't come in out of the cold, but their benefits are still theirs. So to get them into care, get them into housing. We will be going, the American Legion on a national level and as a state level have been partnering with the Chamber of Commerce, and locally, the most recent one was in West Haven 3 weeks ago, had a jobs fair where some 250 veterans came in and they got job interviews. We will be going on the 16th to the club room at Rensselaer Field with some 250 agencies on a Heroes for Hire event, and we'll probably see some 1,000 veterans going through there. And my staff is there because we want to make sure that not only on the jobs front, but as far as the benefits front, is there training available? Is there training dollars available? Are there educational benefits? Coming home and going to school, when I used the Vietnam era educational benefits, it was easy. I just signed up for them and the benefits came. A veteran coming home now has to be accepted at the school. The school has to process the paperwork. It has to go to Buffalo, and it has to get processed with all the other ones in Buffalo, basically for this part of the nation, and sometimes it's 3 months. And the schools are unfortunately resistant to letting the veteran start classes unless that check's in the mail. So we intercede on that. So on the educational front, on the homeless front, we are doing, I wanted to share, this is our 2011 annual report where we visited some 31 VA hospitals, a task force made up of
what's the geographic area of 31 hospitals? Nationally?
Nationwide.
Okay.
So we go all over the country. Connecticut has been visited twice. We have a task force at the national level. And the task force, as chairman of the VA and our commission, I was in charge of that. We looked at the access to care for veterans, quality of care, funding, staffing levels, looking at everything with an open eye, holding roundtables in the community to talk to the folks about, including staff, about what some of the issues are, how they can improve things, because the VA hospitals, even though we see lots of dollars being thrown at the VA, the money doesn't always go to where people locally, and this is always true, where not enough seems to come to our hospital. So looking at the quality of care, case in point, they started traumatic brain injury centers at several hospitals nationwide, and we went and visited one of those in Milwaukee, and they had 12 rooms that were set up to handle the worst spinal cord cases. And they had staff for all those, yet there were 16 rooms. And on their thing it said they had 16 rooms, and it took us about an hour to get them to admit they didn't have the staffing for those other 4 rooms. So they had room for 4 more veterans, but they couldn't take care of them. So as the American Legion, we went back to Congress and to the VA central office and said, this is a great thing, but you have to provide them staff.
Now there has been reports in, like in 60 Minutes, that have been, quite frankly, unflattering to the VA system and the hospitals and services rendered. How does your office deal with that? Is it? I mean, I'm also kind of maybe asking unfairly.
No,
are
it's
those
true.
criticisms, their validity to them, and how do you help broker these situations?
Obviously, I'll harken back to one of those 60-minute pieces with Diane Sawyer, who talked about the Cleveland VA hospital. Had a very scathing expose and showed surgical suites that were dirty and things were laying down. But 60 Minutes sat on the story for 17 months to a politically expedient time to show the story, by which time a brand new state-of-the-art surgical suite had been running for more than 15 months. So one of the reasons why that old one was down was because everything was transitioning into the new suite. Now, are there horror stories that are absolutely true? Yes. The VA healthcare system is the largest healthcare system in the world. And there are some 229,000 VA employees, both in the healthcare system and in the benefits system, and very much to a smaller degree in the cemeteries administration. So you have staff and people can get relaxed in their job. There is no excuse for it. On the other hand, on the other side of the coin, I can attest from using VA healthcare that they have some of the absolute best doctors in the world. They have the best technology in the world. The latest efforts, some of their clinical studies set the stage for the advancements for the next 20, 30 years. The advancements in all the prosthetics are basically from different VA hospitals. They're doing research for PTSD to use video and where they're taking the veteran back and walking them safely through whatever that experience was that so stressed them out. So as a American Legion, we try to make sure that we exercise oversight over the VA as users and as advocates, because there's a lot of money, and a lot of money can get misspent, or it can get directed to the wrong place. So our job is to make sure that the money goes to the veteran, the care goes to the veteran. There's some great GS-13s, 14s, 15s in those hospitals, but we'd rather, instead of bonuses going to them, that the bonuses maybe hire a extra nurse.
Now, in Connecticut, how many VA hospitals are there?
There is what is now known as the VA Connecticut healthcare system. It used to be two separate and distinct hospital campuses. The West Haven VA Hospital with a strong affiliation with Yale.
Okay.
And the Newington VA campus with a strong affiliation with UConn. For staffing and funding, the affiliation with UConn isn't as strong as it was in the past. It is there.
Is this the UConn Farmington?
UConn Farmington, UConn Dempsey.
The Dempsey.
Yes. Governor Weicker kind of pulled all the folks back to the UConn hospital because UConn needed to make money so they could keep their hospital open. Be that as it may, there are 2 hospital campuses. West Haven is the main campus because that's where the inpatient surgical suites are, where the inpatient beds are for aftercare patients for PTSD. They have a very strong partnership with Yale. Some of the healthcare is, I'm going to say, farmed out to off-site, and I'll state my own case in point. I went through prostate cancer treatment, and through the VA, and that care was delivered at the Yale Shoreline Cancer Clinic in Guilford, and I spent 15 minutes there every day for 5 days a week for 9 weeks, and it's first-class care for veterans that are looking at their healthcare premium dollars. If you're eligible for the VA healthcare, I encourage them to get enrolled. My 2 months of treatment costs me as a veteran in the VA healthcare system less than $300.
Out of pocket, that's
Out of
pretty
pocket,
reasonable.
that's very reasonable. So they have world-class care, but to the hospital, so there's West Haven, Newington, which is primarily a big outpatient facility, which also where the VA, where the Benefits Administration regional office is. It's a huge campus. But they provide all the clinical services, mental health care, eyes, ears.
Is transportation included? Here we are in southeastern Connecticut. We're roughly an hour away from Newington and West Haven, or if you're in Greenwich or other outposts in the state.
Transportation, if you're a service-connected disabled veteran, there's so that your care is covered and paid for, and your transportation is therefore paid for. Transportation is provided not as much as it ought to be, or not as much as it should be, through the VA transportation system, through the very fine DAV transportation system, where their drivers are basically professional drivers. That's what they do. They're volunteer. They volunteer, but they're trained and they're paid, and they drive folks back and forth. But to combat that, so they don't have to drive to West Haven or to Newington, there is a clinic in downtown New London. There's a clinic in Wyndham. There's a clinic in Waterbury and Winsted and Stamford, so that those outpatient clinics are within 30 minutes or 30 miles of every veteran in the state.
That's important to know.
It really helps. And for our young people going to college, if they enroll in the VA healthcare system and they're going to UConn or Central or Southern, it's a opportunity. It saves them about $1,600 a year, because if they don't have qualified health care, then they're going to bill you for it. And if the GI Bill is paying those fees, you're never even going to see that $1,600. But $1,600 is a semester class sometimes.
Yeah. Folks, you're watching City Focus, and I'm Marty Olson. I'm joined this evening with by K. Robert Lewis, who's the Department Service Officer for the American Legion here in Connecticut. We're discussing veterans and veterans benefits, and it's been a real healthy discussion, and we're live. If you'd like to join the conversation, please call. The numbers are on the screen. We can be reached at 860-440-3154 or at 800-253-2285. And I know that we have veterans who are watching, and we have families of veterans, we have survivors, etc. And I think this is a wonderful opportunity. If you have any questions, you've got a real expert here as my guest to answer your questions. So please take advantage of this opportunity with K. Robert here right at the fingertips of your phone. So give us a call and let us know what you're thinking, or if there are questions you have in terms of accessing services, or if there's any way that his office could be of assistance. And we're getting our first call of the night. Good evening, and you're on the air.
I have my pen here.
Hi, I wanted to ask Mr. Lewis if there was any way he might be able to help. My father, for years, has been trying to get some kind of paperwork to prove that he was in the reserves, Army Reserves. And,
as far as military
he's been to
paperwork?
Washington and talked to this one, that one, and the other one.
Mm-hmm.
For years, we've been trying to get him something. I guess at one point they had a big fire in Washington, and it had a lot of records.
I'm glad you mentioned the fire. The fire was in 1973 at the National Archives, the National Personnel Records Center, which is part of the National Archives, in St. Louis.
St. Louis.
A number of files were destroyed, but many more were damaged, that were singed or water damaged. So are you trying to find medical records or personnel records?
Some kind of proof that he even served. He served for 7 years in the Army Reserves.
Mm-hmm.
And he has photographs and things like that around, but he doesn't have any kind of paperwork to show that he was actually there. And I wondered if somehow maybe you could help him with that.
This is something we do every single day. If you would call, if you call our office, I don't know if they posted the number up, but it's 860-594-6600, and we'll be glad to start the process. A lot of the issues, if your father was only in the reserves, all the records aren't always at the National Archives, because if he was ready reserve, if he was active reserve, the records are there somewhere, and they can be reconstructed. And this is one of the things we do. We were able to just in the last 2 weeks receive some medals for a Vietnam veteran, and get some documentation that proved that he was actually in Vietnam, which is helping him with his benefits claim.
Yeah, my father has his dog tag.
Mm-hmm.
And I guess some number that he was.
There we go. We've got the number on the screen. So I would hope, ma'am, that you would give Mr. Lewis his office a call tomorrow. Don't waste any time, and
okay.
then they'll get right on that.
I just want to confirm the number is 860-594-6600.
Yes, it is. And please, because we're part of the VA facility, if you call before 7:30 or after 4:30, it rolls over into dead space, into a call tree. So please call us during business hours, and we have voicemail, and it is what we do, and I'll gladly assist.
Well, I hope you find that to be beneficial.
Call before 7:30 a.m. or after 7:30?
After, please.
Okay. Thank you so much.
Thank you for calling. That's what we're here for, to try to help out. Well, this gives me a little bit of an inkling on your sphere and scope here.
Pretty much everything, yeah. If it involves veterans, we do it. We were talking earlier about healthcare access, and we have the largest healthcare system, but not all veterans have access to it. And we have a number of older veterans now who are now finishing work, are faced with skyrocketing healthcare costs, and we are based on a priority system. and let me preface this by saying that if you were an active user of the VA healthcare system in 2003 and have stayed active ever since, it doesn't matter what your income is, as long as you use it. If you didn't use it and you dropped off, then everything is income-based, except if you were a returning OEF veteran, you had a 5-year window, regardless of income, where you could enroll and stay and be grandfathered in. It got a little confusing for some of the other veterans, but those are the rules that Congress set up, and the access is basically, most veterans in this part of the country qualify in one way or another. If you don't qualify financially, if you have a service-connected disability, we will assist in getting that certified, covered, compensated, and that gets you into the healthcare system where the VA will cover that, and you'll have access to the other healthcare, but you'll have to pay for it. Again, a specialty visit for healthcare is $50. And this is no premium. This is your healthcare cost. This is your copay. Your primary care visit and lab visit is $15. Prescriptions are $9 for a 30-day prescription. If you roll everything else into that with all the other healthcare costs, it is affordable, it is doable. But on the benefit side, and one of the big issues that we have is a lot of veterans are asking, what's in it for my wife? Now, if you're a military retiree, obviously TRICARE covers that. But for the non-retirees, if a veteran, if he or she is adjudicated a 100% service-connected disabled veteran, the VA provides a program called CHAMP VA, which is a medical insurance program for your spouse, where they pay the premiums. Some care is provided by the VA at the VA healthcare facilities. Other care is more often than not provided locally, and the VA pays that bill. If a veteran is disabled at 100%, either through a total disability, and a total disability doesn't mean totally disabled where somebody can't move. It's a degree of functioning on the ability of a veteran to basically hold it down a full-time 40-hour-a-week job.
Okay. I've got a question for you.
Sure.
That with Obamacare kicking in over the next year or so, will the benefits, as you're kind of been outlining them over our hour, are they going to remain constant, or is this going to get all muddied up in the waters with this new national healthcare system? Or do we need another hour to discuss this?
I can probably, as designed, if somebody's in the healthcare system, nothing should change. The VA, and I'll say this only because I got something in the mail recently where all veterans that are participating in the Million Veterans records thing, we're providing medical information, they're providing us healthcare books. But in the back it said, for the first time, make sure you pay your Medicare bills, because medical care is not a mandatory funded program. It's a discretionary funded program, and if this drops now, so I can only say that I'm uncertain. I believe it'll stay the same. It's a great model. It would take some of the strain, and when I talked about Medicare, one of the things that the Legion's been fighting for years, if an otherwise eligible veteran for VA health care, and we're talking about paying co-pays and everything, is also Medicare eligible because he or she has worked all their life and paid in this. Medicare is a prepaid plan. If they use the VA health care, they can't use their Medicare to help pay for some of that. They can use their Blue Cross, Blue Shield, Compass, any of those, but not Medicare. And we did a study, and this goes back to when I was working for the congressman. We focused on the Providence VA hospital. And with just the 55 and up, or the 65 years old and up veterans that were already enrolled. And we looked at, it was a $25 million turnaround for that VA hospital, which meant it took them from $9 million out of the red to some $16 million in the black, which meant they could provide additional care, hire more people. And yet, one of the questions that veterans ask, and it's never been answered, is if I'm using the VA, who's using my Medicare?
Mm-hmm. Interesting question.
Especially with the Obamacare model, but I would encourage people that if you have an issue, if you have a friend who has a issue, a brother, a sister, a husband, a wife, who has served, that you think may benefit by sitting down with us and discussing their circumstance to see if they may or may not have they may or may not want to file a compensation claim. Sometimes people, just as our previous caller, they just want some information, they just want some closure. We have a number of, I can tell you we have a number of young veterans in this area that were activated through the National Guard. Myself, personally, I have a niece on a NATO AWACS team in Germany, and a 20-year-old nephew sitting on a mountaintop in Korea, where it seems that things started happening the day he got there, and he said, I didn't know they were going to have a party for me. But so the American Legion is, especially service officers, when we serve veterans. They don't have to be members of our organization. We serve new veterans and try to help the families when that veteran is overseas, so that when they do come home and they talk about who helped them, that if they think about joining a organization, that they think about us, because as I said earlier, our salaries are paid because we have members who pay their dues, who believe in the mission of the Legion. And if a veteran were to ask, well, what's in it for me? And this is one of the things that's a personal, it's positive, it's forever, it's in it for you, for every other veteran. And we serve.
The Legion, my introduction to the Legion was as a young boy, because they sponsored baseball teams.
Yes, they did. We still do.
And probably still do. And and the kind of almost post-high school program, American Legion Baseball, a national program. So you've got giving back to the community as well.
And as somebody who I know loves this level sports, there is our Legion World Series has a permanent site in Shelby,